the difference between dependence, tolerance, and addiction, real briefly. What's the difference? Okay, let's talk about that. The first thing that happens in our work is people become dependent. Dependency just means they're physiologically, biologically stuck on something. If you take oxycodone or Vicodin or anything for a couple of weeks, your body will become dependent. That's all it is. Dependency is not addiction. Dependency just means your body's used to it. You stop it, you're gonna have hell to pay, okay? Insulin-dependent diabetics, they're insulin-dependent. Oxygen-dependent lung patients, they're dependent on oxygen. They're not addicted to oxygen, they're not addicted to insulin. But if they stop all of a sudden, there will be problems. The second thing that happens is going to be tolerance. Tolerance basically means it takes a little bit more to get the same job done, okay? The medicine used to work well, and then it settles in. People sometimes say, oh, I got immune to it. But frankly, they don't get immune to it. That's not a thing, okay? They simply get tolerant to it. It settles down, it settles in, very much like cereal in a box, okay? And that's what tolerance is. So it takes more and more and more to get the same job done. That is still not the same as addiction, okay? Addiction, on the other hand, is more the behavior. It's the why, not the what. That's the big differentiation between addiction, okay? It's not so much what you're doing, it's why you're doing what you're doing. That's where the addiction really comes in, okay? That's the big difference. The question is not why the addiction. The question in our business is why the pain. Why the addiction? It's why the pain, okay? Why the pain? Why the depression? Why the trauma? That's the question we have to answer. So while we're treating their addictions and we're treating their chemical dependencies with methadone or Suboxone or whatever, we have to remember that the underlying question still needs to be answered. And that's the why, okay? I had a 16-year-old kid who I asked, what did the heroin do? What did you like about heroin initially? And his answer to me was, when I use heroin, I feel like I'm being held in my mother's arms, okay? There's your why. It's not what, it's why they're doing it, okay? And that's what we have to get after, and that's why we're focusing on also addressing the medical and psychiatric problem in these patients and not simply giving them methadone, because we do want to try to address that. So remember, 3 parts to what we're doing. Part number 1 is dependency. That's just a biological thing that happens over time. Number 2 is tolerance. It takes more and more and more to get the same job done. The new car smell wears off. The cereal in a box settles in a little bit. It's still in there, just looks a little bit less. It takes more and more and more to get the same job. And the third part is the addiction. The why. Why are they doing what they're doing? And that is what we're after.